Okay, good afternoon everyone. My name is Ryan and I'm staff of infectious diseases research study in Bandung. So I would like to present to you my slides about neglected tropical diseases, but in a pharmaceutical global health perspective. So before we start, I would like to ask you several questions, but keep all the answers to yourself. And I might want to be asking about these questions later after I finished. Okay, so question number one: which of the following is not part of neglected tropical diseases? Okay. Be careful, I'm going to ask one of these questions later, so be prepared for the answer. And then question two, there is actually a well-developed vaccine for dengue fever. True or false? Look at the item. Okay, number three. What is the treatment of choice for lymphatic filariasis? I'm certain most of you know this answer, but we'll keep going on. And the question number four, explain the connections between these: poverty, inequity, and neglected tropical diseases. Okay, give the answers to yourself, and let's start. Okay, so what is a neglected tropical disease, or what are them? So NTDs, or neglected tropical diseases, it comprises of 14 parasitic and bacterial infections. Now, most of you would ask me a question: why would I bring such topics into our discussions? So the sense of urgency, it is built by the features that neglected tropical diseases have that most of diseases don't have. It affects 1/6 of total world population, and 90% of the disease burden is in Africa, which is the developing country. And although it may not be the first killer disease, it can cause severe impairments that may occur after years and years of silent infection, and most of them are irreversible. And because of these severe impairments, it can reduce further the economic productivity of people, thus incurring millions in poverty. So these are neglected diseases that I would like to discuss with you all. There are protozoan infections, which are leishmaniasis and human African trypanosomiasis and Chagas disease, and the most common neglected diseases like the helminth infections like soil transmitted infection, ascariasis, trichuriasis, hookworm, and lymphatic filariasis, onchocercariasis, schistosomiasis, drunculiasis, and cysticercosis. And there's also viral infection, dengue and dengue hemorrhagic fever, and bacterial infections like leprosy, trachoma, and Buruli ulcer. I believe most of you know most of these diseases, although it's not uncommon, but we as a pharmaceuticals representatives also deal with these diseases. So these are the diseases. The first one, it is actually cut. It's a lymphatic filariasis. So it's a worm infection that can cause a disease, elephantiasis. So as you can see from the image, patient receiving treatment. This is a patient receiving treatment. So although these diseases manifest long and may not be the first killer, but look at how it can how it can make this person disabled. And also on